Ya Ali Medad. I am Dr. Aleesha Adatya and I am an oncologist. As officials around the globe were easing lockdown restrictions caused by the coronavirus pandemic, we are faced with finding a balance between personal safety and personal freedom. If you are nervous about going to life back to normal, you are not alone. Today, we will talk about how to get back to work, how to protect your family, your friends, your colleagues, and others from the further spread of COVID-19 by taking these simple precautions. Regularly and thoroughly wash your hands with soap and water or use alcohol hand rub for at least 20 to 30 seconds. Maintain at least 1 meter or 3 feet distance between yourself and others. If you are too close to a sick person, you can breathe in the droplets, including the coronavirus, if the person is infected. Avoid going to crowded places. Where people come close together in crowds, you are more likely to come into contact with someone who may have the COVID-19, and it is most difficult at that time to maintain physical distance of 1 meter. Stay at home and self-isolate, even with minor symptoms such as cough, fever, and a headache, until you recover. If you need to leave your house, wear a mask to avoid infecting others. If you have a fever, cough, or difficulty in breathing, seek medical attention immediately and follow the directions of your local health authority. Make sure you and the people around you follow good respiratory hygiene. This means that covering of your mouth and nose when you're with a bent elbow when you sneeze or cough. Then dispose of the tissue and wash your hands immediately. By following good respiratory hygiene, you protect the people around you from the viruses such as cold, flu, and the COVID-19. When you get to work, make sure you disinfect your phone, your name tag, your ID, your desk, your keyboards, or any work supplies that you use regularly. Perform hand hygiene after using frequently used objects and surfaces. Avoid handshakes and high fives. Disinfect your lunch space before and after use. Practice physical distancing. Promote regular and thorough hand washing to your employees or customers. Put hand sanitizers in prominent places of your workplace and make sure you keep refilling them. You may display posters of hand washing as well. After you get back from work, before you go home, again, make sure you disinfect your name tag, your ID, or whatever you may be taking home. However, leave as much as you can at work. If you change your clothes at work, place your dirty clothes in a bag and keep it in the trunk of your car or directly into your washing machine when you reach home. When you arrive at home, keep your shoes clean by disinfecting your shoes with antiseptic sprays or antiseptic wet wipes. Leave your shoes in a single space, preferably by your door. Dirty socks belong in the wash and not on top of your shoes, and clean your hands immediately after shoe handling. Shower immediately after arriving home so that you can spend good quality time with your families. Washing of clothes. Do your laundry as you normally would with soap and water. Once it is dry, make sure you handle your clothes by washing your hands before storing them carefully. Wash your fruits and vegetables as you normally would. Before and after handling them, wash your hands with soap and water. Remember to continue your exercises and yoga. The benefits of exercises are enormous. They include, but are not limited to, helping you with stress and anxiety, boosting your immune system, mindfulness, weight management, and improving your muscle and joint flexibility. If you decide to exercise outside, do it with the precautions I have mentioned. Along with this, proper nutrition and hydration are vital. People who eat a well-balanced diet tend to be healthier with stronger immune systems and lower their risk of chronic illnesses and infectious diseases. So you should eat a variety of fresh and unprocessed foods every day to be able to get your vitamins, minerals, dietary fibers, protein, and antioxidants your body needs. Drink enough water. Avoid sugar, fat, and salt to significantly lower your risk of being overweight, obese, getting a heart disease, diabetes, and even certain types of cancer. Schedule your regular appointments with your doctors to keep a tab on your comorbid and screen yourself, especially for the non-communicable diseases such as the heart diseases, the diabetes, and the cancers, because these still exist. The coronavirus will continue to have many feeling lonely, helpless, and looking for support, especially for the ones who have lost a loved one or who have lost a job or a business to go back to. Continue seeking mental health advice from CCS. Keep up to date with the latest information from trusted sources such as the WHO and your local and national authorities. Local and national authorities are best placed to be able to advise you in your area what precautions you should be taking. An easy way to remember: avoid men, mouth, ear, eyes, and nose, and follow women. Wash your hands regularly, obey physical distancing, mask up, eat well and exercise, and no unnecessary travel. This pause in life has definitely taught us gratitude, and we should all come out of this by being thankful and continuing to pray with a smile. The current situation is inspiring people to do things differently, which in the long run could be a good thing, a really good thing. So if you want to sing while running, do so. If you want to dance, do so like no one else is watching you. This pandemic will continue to change life as we know it. Might as well make the changes positive. Take good care of yourselves and stay safe. Ya Ali with that.